Hello, my name's Fay McGill, and I'm a speech-language pathologist and clinical program assistant at the Hanen Centre. Today we're going to talk about the types of sensory needs that you may see in a child with autism, as well as general ideas for how you can help a child cope with sensory needs. As speech-language pathologists, we're interested in a child's sensory needs because this can have an impact on interaction and communication. So what do we mean by sensory needs or preferences? We all have certain sensations that we either really like or dislike. For example, have you ever found that you're so bothered by the feeling of the tag in the back of your shirt that you had to change tops immediately? Or are there certain sounds that you find intolerable, kind of like nails on a chalkboard? Well, these are all just examples of sensory preferences, that is, a desire or dislike for certain sensations. A person may be oversensitive to certain sensations, and this means that they may be easily overstimulated or overwhelmed by that sensation and may even start to avoid it. Let's think of a few examples that we might see in a child. A child might be oversensitive to movement if you notice him avoiding playground equipment, or crying if you try to put him in the swing, or looking fearful as you approach the escalator. A child who is oversensitive to sound might cover his ears when he hears the vacuum start, or become upset when the children start to sing at circle time. A child who's oversensitive to sight might prefer dark spaces and avoid bright, sunny rooms. A child who's oversensitive to touch might be very particular about the type of clothing they wear, maybe avoiding things like buttons, tags, and zippers. Or you might notice that they cringe or push away as someone approaches to touch them. You might also notice children who are oversensitive to certain smells or tastes. A person may also be undersensitive to certain sensations. And this means that it may take more of that sensation to stimulate them and maybe lead that person to seek out more of it while potentially ignoring other things in their environment. Let's think of a few examples of this. A child who is undersensitive to movement might be constantly on the move. You may see them doing lots of running, jumping, skipping, or climbing, for example. For a child who's undersensitive to sound, you might see that they enjoy turning up the volume on their TV or computer, or that they gravitate to toys that make sound or music. For a child who is undersensitive to sight, you might see things like they watch toys up close, watching parts of it move, or they may enjoy dropping objects to watch them fall. A child who's undersensitive to touch might seek out objects of different textures to touch and feel. You might also notice children who seek out a different kind of touch, deep pressure. For children that seek out deep pressure, you might see things like children who enjoy crashing into cushions, or even crawling into tight spaces, like behind the couch. You might also notice children who seek out certain tastes or smells. A child can also have a combination of these patterns, as they can be oversensitive to some sensations, yet undersensitive to others. If you notice any patterns like this in your child, it can be hard to know what to do, but it can be very helpful to consult an occupational therapist who can give you tips to work specifically with your child. You can also refer to checklists about sensory preferences to gather more information for yourself. The Hanen More Than Words guidebook includes such a checklist, and this can be really helpful to gather more information about your child's sensory needs. Once you have an understanding of your child's sensory needs, you can then use this information to think of ways to help your child cope. If your child is oversensitive to certain sensations, you may want to help him avoid them if possible. Making certain changes can free up your child to concentrate on other things without being bothered or distracted by his dislikes. Here are some examples that I've seen before. For a child who's oversensitive to touch, it can be helpful to choose more comfortable clothing if he's sensitive to certain textures. Give him warning before you're about to do something or touch him. For example, if you're about to take off his Band-Aid, warn him by showing him and telling him what you're about to do. For a child who's sensitive to sound, there are some modifications that you could make. For example, in a classroom, you could consider placing socks or parts of tennis balls under the legs of chairs to dampen the sound when they move. You could consider avoiding going to really loud places with your child, but I've also seen families use noise-canceling headphones when they do go to loud places. These are just a few examples. Of course, you'd have to decide what would work best with your child. On the other hand, if your child seeks out certain sensations, you may need to find creative ways to help him get these needs met. Sometimes children engage in repetitive behaviors as they are seeking out certain sensations. And while it may be tempting to try to stop this, it can be much more helpful if you can use these sensory preferences to create a game that you can play together. If you can do this, you're not only satisfying your child's sensory needs, but also creating opportunities for interaction and communication. Our next video will talk about how you can start to think about creating these interactive games that you can play with your child. I hope you found this overview helpful. Remember, for more specific information about your child's sensory needs, you should consult a professional like an occupational therapist who can help. Thank you for watching, and I hope that you stay tuned for our next video.